You know what they also do here at JenCare Senior Medical Center? They also treat many different illnesses. And joining me now to talk all about the different illnesses that they treat here at JenCare, please help me welcome Dr. Latoya Fulton. She is a primary care physician with JenCare West Bank. Good morning.
Good morning. Thank you for having me.
Thank you so much for coming on the show this morning. I know here at JenCare you all do a lot of different things when it comes to treating illnesses. What are some of the illnesses that you all work with?
So we treat everything from the common cold, diabetes, high blood pressure, a host of things, COPD, cardiovascular diseases, anything from the beginning to the end. We walk you through everything. We make sure that we provide you the necessary medications needed to make sure you stay on top of those illnesses. So we treat almost everything, and those things that we can't treat in-house, then we make sure we set you up with a specialist to take care of those things as well. So we pretty much can take care of the whole well-being of the person.
And we'll be learning more about the specialists coming up a little bit, so stay tuned for that. You know, we talk a lot of times about treatment and the different ways that treatment happens. What are some of the different ways that you all treat maybe a common condition like diabetes?
Okay, so with diabetes, one thing we do, we make sure that we take each patient into account based on their current situations. We start by teaching them about the type of diet they should follow, the types of things that they need to include in their daily life to make sure they stay healthy, such as exercise. We also have medications. We actually have a pharmacy at JenCare in Metairie, and we provide the necessary medications our patients need to make sure that diabetes is well controlled. Diabetes can be treated with oral medication pills, or we can do insulin and things like that. But the best thing we do is try to prevent them from falling into the complications that can be a result of diabetes. So we make sure we well educate our patients to make sure they know what they need to do. And if they have any questions at home, they have our cell phone numbers. They are more than welcome to call us and ask those questions. My patients call me, they text me, they email me. Whatever way they feel comfortable to communicate with me, that's what they do.
That is amazing. And again, not only can you call JenCare, you can also call their hotline that is open right now. You're seeing the number at the bottom of your screens. That's 504-684-7572 if you have any questions about JenCare right now. And we often talk about, you know, having a treatment plan, which I think is awesome that you all give them that. How important is it, and why is it important that we try to treat these illnesses early?
It's very important. For example, if somebody has congestive heart failure, we educate our patients on that. We tell them, okay, if you notice on your daily weights that your weight is going up, you need to contact us right away, because what we do is we make sure they have the water pill, as patients call it, but furosemide is one of the medications we use. It can be in pill form, or we can give it through IV or injections, all of which we have in our clinic. So we tell them, let us know early, because if we can get ahead of that, we can prevent them from being hospitalized. And that's the biggest thing. We try to keep our patients out of the hospital as much as we can. And by early treatment, that prevents that. And so our patients know that. So they know to call us first if they're having any issues. Earlier the better. Because
what's cool about JenCare, you get your doctor's cell phone number, which is a huge benefit. Now, for some people, we all know we're going through a pandemic right now. For people who, especially seniors, who may feel uncomfortable stepping out of their homes to come and see the doctor, what are some at-home options you all offer here at JenCare?
So one of the things we have started doing since the pandemic started is telemedicine. So telehealth, where we can call patients on the computer, or if they have smartphones, we can use that as an avenue where we can talk to them, we can see them, they can see us. And so we can tell them what they need to do to stay healthy. Also, there are times we are able to send our nurses out to their home to make sure that they have all the medicines that they need. And then the patients are able to get that connection, that contact with the individual coming into their home to take care of them.
Because that is the JenCare difference, which I love so much. Dr. Fulton, thank you so much for being here. Don't forget that hotline is open right now. You're seeing the number on your screens right now. 504-684-7572 is the number to call if you have any more questions about JenCare.